Good morning. I am Dr. Sudhir, Senior Orthopedic Consultant working at Unitas Hospital, Tamara. Today we are going to see about a condition, very common condition called periarthritis shoulder. Periarthritis shoulder is otherwise in common language called as frozen shoulder. So it is common in a lot of people who have diabetes. So periarthritis shoulder will happen when your sugars and diabetes is not under good control. So basically what happens is the symptoms with which the patient present is pain in the shoulder with decreased movements. So the movements will be grossly restricted. He won't be able to turn his shoulder inwards and outwards, and he won't be able to lift it up. So when we examine, we will be able to make a very big differentiation between the normal side and the abnormal side. Periarthritis shoulder, the treatment is, there are two types of treatment which is available for periarthritis shoulder. One is conservative management. Conservative management means, in the sense, we will treat the patient with analgesics, painkillers basically, along with physiotherapy. In the physiotherapy, they give something called, suppose your right shoulder is affected, they give something called shortwave diathermy. It's also called as SWD. So that basically gives heat to the shoulder to reduce your pain. Other than that physiotherapy, there is other modalities, physical modalities consist of mobilization of the shoulder. So basically in the physiotherapy center, you will have a wheel, big wheel for which you have to use your affected limb and try and rotate the wheel so that the movements will improve. And also there is something called pulley in the physiotherapy department, where a pulley will be there with the rope. With the rope you pull the other hand. Use a normal hand to pull the other hand so that the movements improves. Okay, this is basically the frozen shoulder can become normal by itself at the end of 1 year. Can, I'm not saying will. So if a patient doesn't want to have physiotherapy and analgesics, he can go through the pain for 1 year, and at the end of year it can become corrected by itself. Sometimes it might not. Even after 1.5 years he will have still pain. That's when we have to go into the second modality of treatment. The second modality of treatment is not surgical, but it is done. It's under anesthesia. It's done under anesthesia. It's called manipulation under anesthesia, wherein which the patient is made to sleep by giving anesthetic agents, and the shoulder is fully mobilized when he is under the anesthesia. Fully mobilized. Basically, in a periarthritis shoulder, there's muscles around the joint, that is the bones, is tightened. So you have to release them, either by physiotherapy or by manipulation under anesthesia. So once the manipulation is done, that's not the end of the treatment. Even after manipulation under anesthesia is over, he needs to continue physiotherapy. So of late there are surgeries also available. Even patient with periarthritis, they can have surgery done. That is done through arthroscopy. Arthroscopically they put in the arthroscope and release all the tight structures or the capsule and the muscles which are attached to the bone, so that the release is complete, and immediately the patient can move it with less amount of pain. So these are the various modalities for the treatment of periarthritis shoulder. Thank you.